Yeah, this is Robin from the Back Pain Secret podcast. And today's episode is called How to Deal with Back Pain Anxiety. How to Deal with Back Pain Anxiety. I'm going to be right back after the intro song.
So here's the important question. How can back pain sufferers like us, who don't want to use prescription drugs or go through surgery, heal our back pain? How do we live our daily lives in a way that allows us to go to work, take care of our families, enjoy life, and still manage our back pain? That is the question, and this podcast will give you the answer. My name is Robin Wakeham, and welcome to Back Pain Secrets.
Okay, guys, so I'm back, and today's topic is how to deal with back pain, okay? To give you a little bit of an insight what's been going on in my own life over the past couple of days here, I'm doing this every second day now, more or less going live, Usually I do it every day, but I got some shit to do in my life here that I need to take care of. So you just have to bear with me, okay? All kinds of stuff, I'm still doing this renovation of these three different clinics. It's taking quite a bit of time. I'm trying to be a good husband and dad also to my two kids, my beautiful wife, Linda. So things are piling up, but I want to go live here and talk about this because this is more or less like one of the things that bring me most joy in life here, and also that I'm actually getting some traction now on my Facebook page, Back Pain Secrets TV, and the podcast is just taking off, so I'm happy about that, and I'm going to keep on doing this, so if you have back pain or you are struggling with anxiety or know anyone out there that have these problems, please share this episode, and tag me. Okay, guys, so today's topic, how to deal with back pain anxiety. And as always, I have a patient story for you guys. And today we have Scarlett, an old patient that I had. It's a made-up name, of course, to protect the innocent. She's 44 years old. She has two kids, and she's having some kind of marital problems when she was visiting me. She works at a bank with like something called risk analysis, basically where she goes through a lot of numbers and see, if they should do the deal or not. So she's very good at that, and also brings her some problems in her ordinary life because everything she experienced, she's calculating the risk, in her mind or in her computer. And for the past 3 years, she's been suffering from back pain. Started off with like lower back pain on her left side. And it increased definitely when she was sitting more and more, at work. And she was working on this small laptop. And nowadays, also in most offices, they don't really have like a set place. It's one of these open area things. You just take your laptop, you walk around, and you get a table. I guess there's some thought about that, but from like a stress level point and from a back pain point, it's horrible, because most people are now sitting at these laptops hunched over like bananas, trying to figure out why they have back pain. And that's the thing, you need to be standing up and do stuff like that. But that's a discussion for a different day, okay? So low back pain, and over the past couple of months now, she had started to get radiation down her left leg, especially when she was in her car or sitting for long periods of time. Her kids were about between 8 and 14 years old, and from her pregnancy, she actually put on a bit of weight, and she hasn't really been able to lose that. So she didn't really feel comfortable to exercise more. Growing up, she was very, very active. She was a cheerleader. She was into cross and field, and she was doing all kinds of this stuff. But now she wasn't really doing anything. She had to walk once in a while, but most days she didn't work out at all. And she was also telling me that as the years grew older here, she was feeling that she was just working, more or less just working, and was less excitement and fun in her life. If you met Scarlett externally, you could see she was working hard. She was putting in like 8 to 10 hours a day at the office. She was also like the perfect mom. She made sure the kids had done all their homework. She kept the house clean. She was like actually prepared all the dinners by herself. And because she came home so late at night, she had to do that during the night or nighttime when the kids went to bed, So she's always on her feet working, trying to serve other people. She had a husband, and the husband was also working quite a bit, and she put on a happy face outside, but you could feel like she was feeling frustrated, and internally she was feeling a lot of anxiety around a lot of stuff in her life, going back to a relationship she had been with her husband for 8 to 10 years there, and she more or less felt like they were more or less like buddies. It was just like so much stuff with the kids and their work. It was more like just running a company at home, and she was getting felt anxiety because she didn't feel the closeness that she felt before, and she felt anxiety that was going to create problems in the relationship further on. She felt this anxiety also that she wasn't enough as a person, even though she was doing all of this stuff, she felt like she could do better all the time. And sometimes when the kids went to bed and she was just sitting in front of the TV, had a glass of wine or whatever, she just thought, this is too hard, why is this is too hard. I'm not going to be able to make this, it's just with the work, with the kids, the relationship, all the demands I have on me. She didn't really understand how she was going to be able to do that, And she also felt this lack of connection with her husband, and she was starting to get like really, really getting on her nerves about that, Also, she had this because she had started to gain a lot of weight, or not a lot of weight, but she gained weight, and that also made her feel less attractive towards her husband, and just think about her body, And the back problems she had was just starting to get more and more intense, because she could actually feel the correlation when she started to feel more anxiety. She felt more back pain. Okay, so she could actually feel that, whenever she started to worry too much and start to feel this anxiety, the back pain increased, and also the radiation down her leg. So this was about the time she visited my office here. We had a chat, and she had all the regular stuff. Like I always say, you need to walk 30 minutes every morning. You need to stand up at your desk, guys, 30 minutes in the morning, at lunchtime or after lunch, and in the afternoon. Okay. You also need to be like, just thinking about your stress level, maybe not have the phone on all the time. Okay. And don't be living on your email and just emailing all the time, turn off all those pings. That's some quick tips you can do today to reduce your back pain. But you know all of this, guys, because I've been talking about this for years now. But anyway, so she came in, Scarlett, and she visited me for the back pain. She got all the ordinary back pain tips. But as we were speaking and talking, she was telling me my main problem is that whenever I feel more anxiety now in my life, my back pain increases. So what do I do with that? So I told her, the first thing you need to do, Scarlett, is to stop worrying about it. You need to stop this risk analyst brain of yours going into frenzy every time you start to feel nervous about something. I know the statistics of everything, and you can do that, but you need to have your work brain and your home brain. Okay. And this as a statistician or good with numbers, most stuff that you walking around and feel stress and anxiety about, it never happens. Okay. So just from that standpoint, it's just stupid to walk around and always feel anxiety, because you're destroying your life, and you're destroying like the experience you have here on Mother Earth. Okay. So what I would tell you to do, Scarlett, is you could do certain things to strengthen yourself in different areas, so you develop more competency in that area, and that will reduce your anxiety and stress level. So think about it. At work, is the stuff that you can actually, a course or something you can take that will reduce your stress level. Is there like a course or book, something that you can read to connect your husband with in a better time? Hey, James, I see my son is actually checking me out on Instagram. How you doing, buddy? He's homesick for today, Jim is home. He's 12 years old, and he's one of my best friend. And we hang out, but he's sick today. Anyway, back to the story. Hey, buddy. Anyway, so you want some stress. Also, I told Scarlett, that you want some stress in your life, because if you don't feel any stress whenever you're going to do something, it more or less means that you don't care about it. Okay, so you definitely need some form or of stress and anxiety. The trick is, Scarlett, is to understand that there is good stress and negative stress. Stress when your boss is on your ass and just screaming at you and just being horrible to you and putting that stress, that's negative stress. Okay, but then there is stress, for example, when you need to have a pitch in front of your at work, or maybe you go out and meet interesting people and stuff like that. That's also stress level, but that's actually good stress. That's stuff that you need to go through and work through, and the more you do it, the less stress and anxiety you're going to feel about it. Okay, and it's also very, very important to understand this relationship. Like, the anxiety is more or less something that you feel, but there is stuff that you can do, and if you do more of that, you will actually feel less stress and anxiety. So that's first off. Okay, so she almost got it, but she was still feeling frustrated, and she told me, but where does this stress come from? Where is it coming from? The anxiety I'm feeling. I told her that there can be many different areas or reasons for this, but you could have, for example, like a lot of people have, like, could have a chemical imbalance in their life, in their head, more or less, or you could have been gone through something, a death in the family, some severe sickness, and you might need to have a chat with someone that's actually has an education, like a psychiatrist. You might need medication, so there is that aspect. But for the regular Joe, the person that just feels a lot of anxiety and stress in their lives, really it's just like three different main areas. Okay, first off, it's like the fear of loss. Okay, a lot of people are walking around here, most people have this fear and anxiety for fear of loss. It could be like you could lose your job, you could use someone doesn't love you anymore, whatever it is. It's this fear that you're going to miss out. Okay, that's the number one thing. And number two, like we talked about later on, I'm not going to be able to do this. I'm not going to be able to handle this. The stuff that I'm going through right now is just too much for me to comprehend. I feel overwhelmed, and the demands on me are more or less just piling up here. A lot of people, what they go to then is like they binge watch TV. They put on Netflix, they drink wine, they eat shitty food, like crappy food. All of that is stuff that you do in order for you to feel good, okay, for a short period of time. But what happens is when you've done that, you feel worse, okay, because you haven't taken care about the problem. But that stuff, so if you're binge watching Netflix, if you're drinking or smoking or taking drugs, or if you're like denying the stuff that dealing with the stuff that you need to deal with, that's signs that you need to take care of shit. You have some stuff in your life that you need to deal with. You need to step up. And also the third reason, disappointment. You know that you could do this, you know what you should do, but you don't do it because you have a fear inside of you, because you're not going to be, you have a fear that you're not going to be able to do it, and you feel a fear for not, like, feeling that you're not enough, that you're not going to be able to do this. Okay, so there's a lot of different reasons, but that's the three main reasons. Fear loss, I'm not going to be able to handle this, and the disappointment of the outcome of what you're trying to do. Okay, so I was telling Scarlett, there's so many things that goes in a life, and obviously you're a bright, beautiful woman, and you have a lot of things going for you. I think it's the main thing you should be thinking about here, is not to try to avoid stress and anxiety in your life at all costs. Okay, you're going to feel that. We all feel that on a regular basis. But what you should do is to change the meaning of when you start to feel stress and anxiety. Whenever you start to feel stress and anxiety, you should ask yourself a question. Why am I feeling this right now? Why am I feeling this stress and anxiety in my life? What is the reason for this? At work, for example, If a boss comes in and he's giving you shit and he's screaming at you, you should think, why is he or she doing this, or are they just having a bad day and they took it out on me, or the relationship, if you're trying to seek attention to your husband, and he's ignoring you, what is going on there? Have you guys been connected over the past week or month? Are you doing stuff on a regular basis, or are you just like, you're not putting in the hours there and not talking and have the confidence to talk to your partner and really tell them how you feel? If you are feeling lonely, you need to express this to your better half. Okay. And the other thing is you need to change the meaning, and understand, like, there is good stress and negative stress in your life, and whatever kind of stress you're experiencing, have the confidence in yourself and the faith that you're going to be able to get through this. Okay, because think of all the other stuff that you've been going through in your life and you've been able to handle. This is something that came up now, and you need to think about it. Is this a rational thing? Will I be able to get through this? And most often the answer is yes. Okay, guys, I got a bit off track there. I just got going. I was freebasing here quite a bit, because, as you know, guys, none of these episodes are scripted or anything. I'm just talking from the top of my head here on, like, thousands of back pain patients that I've had during the years. I'm putting this information out here because I'm hoping that this will help a few of you guys. Then again, guys, if you know someone with back pain and or anxiety or stress, or they just feel like they're losing it, please share this episode, to them, and hopefully it can help them. Okay, guys, that's all for today. And guys, remember, just one step away from healing your back pain. Bye-bye.
Want more back pain secrets? Then go ahead and get your free copy of my best-selling book, Back Pain Secrets, at backpainsecrets.com. Inside this book, you will find my top secrets to healing your back pain without prescription drugs or surgery that have helped thousands of other people just like you.